COVID-19 has threatened our physical health, but also our mental health as well. And in the past 18 months, we've outlined some of the ways people can seek professional help and cope with the added stress because of the pandemic.
But 12 News reporter Kate Walsh shows us the unique perspective of the stress the mental health professionals feel in helping so many people navigate something we've never experienced before.
From people losing their jobs in the last year to others having panic attacks, sometimes for the first time in their lives due to the pandemic's uncertainty, mental health professionals say they've seen an increase in patients, and that's adding to their already stressful workload.
All of these bags and lights with it are all patients that we lost on just our unit alone.
When healthcare workers treating the sickest COVID patients end their shifts, they physically leave their work at the hospital, but they bring home the emotional toll the long hours and experiences of human suffering have had on their mental health. Healthcare workers at Rhode Island Hospital worked through the mental trauma by creating this video of their experiences and displaying these lights for those they lost.
It does affect all of us, me included. You know, this is an interesting experience where we're all affected by COVID in some way.
Dr. Christy Dalrymple is on the front lines of treating patients' mental health during this time. And like doctors in the ICU, there has also been an increased stress that mental health professionals are facing from helping so many people through this difficult time.
As things started to settle into this new way of life, that's when it started to hit and people were recognizing, you know, I'm experiencing a bit more stress related to what's going on. I'm trying to manage all of these different things in my life. And that's when we started to see an increase.
They have more patients and appointments are mostly virtual, so that feeling of loneliness the patients share with therapists is also felt by the therapists.
We're sitting in an office where for a whole day we may not see another person in person, so it can be really helpful to stay connected with others.
Mental health professionals were finding they had to use the same coping mechanisms on themselves as they suggested for their patients. Dalrymple said for her, just a 5-minute walk outside of her office in the fresh air helps her through the day.
It was important before the pandemic and also especially now for as behavioral health providers for us to take care of ourselves and to develop those strategies to be able to take care of ourselves when we're at home, throughout the day at work, so that then we're better able to help those around us.
Dalrymple suggests anyone who's having a difficult time right now to seek mental health help because it can make a world of difference. I'm Kate Walsh, 12 News.